Hi, Dr. Harrison here, and today I want to talk about disc herniations, disc bulges, or disc problems in general. I'm going to talk about the different stages of disc injury and treatment options for those, how we might be able to help you in the office. So let's start out with the earliest form of a disc problem. And actually, maybe let me just start out and give you a brief description of the anatomy of a disc. The disc is made up of two portions, the outer annular fibers, which is a fibrocartilage, and these are set up in ring formation, and they're just circular rings that kind of help support the nucleus, which is the middle part of the disc, and that's almost like a jelly donut. The nucleus is made up mostly of water, about 88%, and the other 12% are just going to be sugars and other enzymes that help keep the disc healthy. So that's kind of the anatomy of the disc. Well, in the earliest signs of disc problems, we see a breakdown in the pump mechanism, and the pump mechanism is the mechanism by which the disc maintains its health. And I go into that in detail on our spinal decompression video, so I don't want to waste too much time on that here, but just understand that when the pump mechanism fails, the disc starts to collapse on itself and the outer fibers start to bulge. Well, now we've got that bulging disc. And bulging discs can present anywhere from no pain at all to severe pain. So some people with a bulging disc don't even know they have one until it's brought to their attention. Maybe they have an MRI on their low back or neck, and the doctor comes back and says, oh, you've got a disc bulge in there, along with something else. So the disc bulge, again, can present all different ways, and you just have to approach it depending on how the patient is presenting to you. So that's the earliest sign of a disc problem. And again, as that pump mechanism fails, the vertebrae come closer together, the outer fibers of that disc bulge out, and they may irritate nerve structures. And if that bulge is creating pain, usually it's going to be because it's irritating local nerves in the area. So that's number one. The second type of disc problem, and the next progression, would be a disc herniation. And in a herniation situation, the inner fibers of that annulus have torn, and they're pushing or protruding outward. So sometimes they'll call it a protrusion, but a protrusion is a herniation. And that's where those annular fibers have weakened or torn, and the nucleus or liquid portion is starting to push through those fibers. And typically we'll start to see some of the water content evaporate out of that disc as that pump mechanism continues to fail. Usually in that situation, the patient might be antalgic, leaning forward, or leaning to the left or to the right, depending on which side that protrusion or herniation is on. Usually they go posterior and lateral to either the left or right. So if it goes posterior and left, you'll be leaning to the right. If it goes posterior and right, you're leaning to the left because the body is trying to lean away from the pain. So those herniations respond many times very, very well to chiropractic adjustments and therapy, or, in my opinion, the best treatment of all is spinal decompression because it helps repair that pump mechanism. And I need to encourage you again, go to our spinal decompression video and watch it because it's very, very informational on why that pump mechanism is so important. And if we can repair that, we can keep you from progressing towards a painful back surgery, so we don't want to see you there. The third type of disc problem that we see, and probably the worst case scenario, would be what we call an extruded disc or a prolapsed disc. And that's where that nucleus is pushed all the way through those outer annular fibers, and now it's out either in the canal by the nerve roots. Usually the patient's in a lot of pain. The pain's kind of irretractable. It won't go away no matter what they do. And sometimes it'll even fragment itself, and we'll get a free fragment. And the only way to clean those up many times, or almost always, is to have surgical intervention, unfortunately. So we don't want to see you there. If you find yourself in an early stage of a disc problem, very, very important to get in and take care of it. If you have any questions at all about what's going on with your disc, if you're having back pain, leg pain, those types of symptoms, call the office. Our consultations are always free. Be happy to sit down with you, figure out what stage you're in and what the best approach will be. I also encourage you, again, go to that spinal decompression video and watch it. It's very informational. I hope you got a lot of information out of this video on disc herniations and disc bulges or disc conditions in general, and I hope to see you soon.